Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is the basics of migraines. A migraine is a chronic headache that affects people for anywhere from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder. It's most common in women and those between the ages of 15 and 55, and most actually become less severe and less frequent with age. How common are they? 18% of women are affected with migraines and 8% of men. So 30 million in the U.S. have at least one migraine every year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of those with migraines have a first-degree relative who also suffers. If one parent suffers from migraines, there's a 40% chance that a child will suffer, and if both parents have them, that goes up to 90%. And more than 90% of sufferers are unable to work or function normally during their migraine headaches. There's a lot we don't know about what causes migraines. We know that there's both genetic and environmental causes. It's known to be an imbalance in brain chemicals, and it's known that serotonin levels drop during migraines. Low serotonin, which is a pain management chemical, can trigger a migraine by letting too much blood flow through vessels that should actually be constricted, and that induces a throbbing sensation. There's a lot of migraine triggers, anything ranging from various foods such as nitrates, red wine, citrus fruits, caffeine. Elevated stress can cause migraines, weather, strong scents, hair accessories, exercise, poor posture, skipping meals, and even smoking. There's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. So that's a myth, thank God. Well, what are the symptoms of migraines? Often a person has unilateral head pain that is throbbing and aggravated by activity. Usually before a migraine, one has an aura, which entails visual or sensory symptoms, such as photophobia, which is bright sunlight, just people want to die. They hate it. Visual scintillations. But 80% of migraines actually have no aura. There's no objective testing available for diagnosing migraines. A CT or MRI scan should be done with chronic migraines just to rule out badness, such as a tumor or an aneurysm or something. But a lot of times it comes down to patient history and the pattern of the symptoms being experienced. And as you can see here, a diary can actually be very helpful for the diagnosis. The International Headache Society requires a patient to have at least 5 attacks fulfilling 3 of these criteria, a 4 to a 72-hour duration. At least 2 of these has to be one-sided, pulsating, moderate to severe in pain intensity, aggravation by or causing avoidance of routine physical activities, and at least 1 of these, nausea and vomiting, or photophobia and phonophobia. Photophobia is light sensitivity and phonophobia is sound. The abortive treatment options. Abortive means you have a migraine and the objective is to abort the symptoms being experienced. There's various. The triptans target serotonin. As you can see here to the right, that's sumatriptan. There's Axert, there's Relpax, Frova, naratriptan drugs, Maxalt, the sumatriptan like you see to the right, and zolmitriptan. Okay, so these are all the triptan medications available. There's a lot of them. Migraine, there's a nasal spray, Migrainol, ergotamine tartrate is Cafrago, and then over-the-counter medications such as Advil migraine, Excedrin, which actually contains aspirin and caffeine, and then Motrin migraine pain, which has ibuprofen in it. There's also opiate medications, barbiturates, and then for the nausea from migraines, there's various, Compazine, Phenergan, and Reglan. Preventive treatment options obviously are meant to prevent the onset of migraines, and the goal is to lessen the frequency and severity. These may include high blood pressure medications, antidepressants, so obviously these are off-label uses, right? Anti-seizure medications such as Neurontin, Topamax, Depakote, and then Pizotofen is a serotonin antagonist. The interventional treatments, there's a few of them. The FDA has approved Botox injections for chronic migraines. They recommend 3-month intervals. And it's actually about a 10 to 20 minute procedure with injections into 32 sites around the head and neck. It is covered. It's FDA approved. For chronic migraines, it's a distinct and severe neurologic disorder characterized by patients who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. That's how the FDA categorizes chronic migraines. Patients treated with Botox averaged 8 to 9 fewer headache days per month compared to baseline, and that is demonstrated in the PREEMPT study. That was the study that the FDA looked at to approve Botox for migraines. Additional interventional treatments, there's quite a few. So occipital nerve blocks can be very effective. Cervical facet or epidural injections, sphenopalatine ganglion blocks, supratrochlear nerve blocks, supra-infraorbital nerve blocks, and then if an occipital block works and it wears off, a patient may benefit from a pulsed radiofrequency ablation of the occipital nerves. Nerve blocks, study of 100 patients receiving greater occipital nerve blocks, over half achieved pain relief averaging 3 weeks. There was a retrospective study on the effectiveness of these blocks for refractory migraine patients. They actually used numbing medicine and steroid. 54% reported being significantly better after the blocks, and this duration lasted up to 6 months. Not just 3 weeks, 6 months. Another study looked at the blocks for migraine. They looked at 27 migraine patients before and after greater occipital nerve, and they also looked at supraorbital nerve blocks. And 85% had pain relief for 6 months on average. The top pain management clinics in Colorado is Colorado Pain. There are several locations in the Metro Denver area accepting over 50 insurances with the award-winning pain management doctors. The number to call is 720-306-9575, and the website to look at is painmanagementdenverco.com. All of the pain management treatments talked about in this talk are offered at Colorado Pain, and plenty more. So call today. This is Dr. David Green with the Colorado Pain Network. Your pain stops here.